Hello, my name is Alistair Lumb and this topic is CGM and exercise. I'm a consultant in diabetes in Oxford and I'm also the Deputy Chair of the Diabetes Technology Network UK, which is a group of UK clinicians who are keen to improve access to technology for people with diabetes. So the learning objectives for this topic are just to recap the effects of exercise on blood glucose, just to ask the question, is CGM accurate during exercise? And then think about how we might use CGM before exercise, in real time during exercise and around exercise, in review of what's happened during exercise, and then particularly after exercise overnight. Before we start, it's worth reviewing what happens to blood glucose around exercise. And what we want to do is think about three main types of exercise. So there's flexibility and stretching exercise, which is something that we need to do before and after activity, often particularly. And this has a relatively limited effect on blood glucose. It sometimes might fall a little bit, but generally will stay pretty stable. The next type of exercise is aerobic activity, which is the kind of thing that you can do for an extended period of time. So that might be a longer run, a longer bike ride, a longer swim. And blood glucose will tend to fall with this kind of activity. The third type of activity that's worth thinking about is anaerobic activity. And this is high intensity exercise, things like sprints and lifting weights. Just at the end, it's worth thinking about mixed activity because that's the kind of activity that's typical of team sports. And unfortunately, the amount of the effect on blood glucose will depend on how much of the different types of activity there are. So if there's more anaerobic activity, your blood glucose might go up. If there's more aerobic activity, your blood glucose might fall. Before we start thinking about how we use CGM around exercise, it's also worth thinking about what are the potential limitations of CGM around exercise. The first is that CGM doesn't measure blood glucose directly. It's measuring interstitial glucose, which is glucose between the cells under the skin, and then using that measurement to make an estimate of blood glucose. Now, when the blood glucose is changing, particularly changing rapidly, the interstitial glucose can take some time to catch up. And so there's a time lag or a sensor lag between a change in blood glucose and a change in interstitial glucose. So that raises the question whether CGM can actually give us an accurate estimate of what happens with blood glucose during exercise. Happily, the answer is that it can. So even older sensors allow us to track blood glucose accurately when it changes during exercise. But we must recognise that it does this with a time lag. And that time lag is probably somewhere between 5 and 15 minutes for most of the modern sensors. The change in blood glucose is tracked accurately. And so we can understand what's happening with our blood glucose as long as we take into account the fact that there's a time lag for the changes. If you're in any doubt at all with what's happening with your blood glucose at any time, check a fingerstick glucose and that will allow you to know exactly where you are at that point in time. So what do we do with glucose before exercise? There's quite a lot of detail on this slide and I'm not going to go through it all in great detail, but what you see is for a glucose less than 7 millimoles per litre, the advice would be to take some extra carbohydrate before starting particularly aerobic activity. Between 7 and 15 millimoles per litre, we would probably proceed to exercise straight away. And over 15 millimoles per litre, we want to check ketones and perhaps bring the glucose down before starting exercise. So how might CGM change this? Well, if we know the direction of travel of the blood glucose, then we can make our decisions more accurately. So if we know our glucose is lower than our target, so it's less than 7 millimoles per litre, but it's rising, then actually we might not need to take extra carbohydrates. So if we're between 5.7 and 6.9 millimoles per litre and the glucose is rising, then actually we don't need to take that extra 15 grams of carbohydrate before the activity. Having said that, if we're between 5.7 and 6.9 millimoles per litre, which is below our target, and the glucose is falling, then we actually need to take more carbohydrate than we planned. And we'd take twice as much carbohydrate before the activity and also at 20 and 40 minutes into the activity. If the glucose is within our target range, so between 7 and 9 millimoles per litre, but falling, then actually we would add some additional carbohydrate and take 15 grams of carbohydrate before starting the activity. So now we're going to talk about how you can use CGM to deal with falling glucose in real time, so during activity. And what you can see from the table is that actually if the glucose is less than 7 millimoles per litre during the activity and falling in any way, then we need to take some extra carbohydrate. If the glucose is between 6.1 and 6.9 millimoles per litre, then we take an extra 8 grams of carbohydrate. Between 5 and 6 millimoles per litre, it depends how rapidly the glucose is falling. So if it's falling at a not rapid rate, then we take 16 grams of carbohydrate. If it's falling rapidly, take 20 grams of carbohydrate. And for any glucose less than 5 millimoles per litre, we'd recommend taking 16 grams of carbohydrate. Now we're going to talk about how we could use CGM to combat rising glucose. So often for aerobic activity, we're using carbohydrate replacement to help us maintain blood glucose during activity. First thing we can do is slow down or stop that carbohydrate replacement. Next thing is perhaps replace some of that carbohydrate replacement with some water replacement. So replace some of the fluid, which will also help to stop glucose rising. If we're coming towards the end of activity, then we could use low intensity activity as a warm down to help us lower glucose. Or if this is before the activity, we could use a low intensity warm up to help us combat a rising glucose. We can also use small correction doses of insulin. These would be half of our normal calculated correction dose. But remember that insulin around exercise significantly increases the risk of hypoglycaemia at this time. Now, we're going to talk about how we can use CGM to review the effects of exercise. The slide is showing the same group of people going to the gym on 2 separate days. And on one day, which is the closed circles on the slide, they are doing their resistance part of their training, so that's the weights part of their gym session, first, and then doing their cardio parts of their aerobic activity next. And what you see is their glucose stays stable first and then falls during the cardio activity. For the open circles, this group does their aerobic activity, their cardio activity in the gym first, and then does their resistance activity, their weights. And what you see is that they start and finish with very similar glucose levels, but they have very different journeys from how they travel between those 2 points. And that's a very useful thing, because if you're going into the gym and your glucose is higher than you like, then you could do your aerobic activity first. If you're going into the gym and the glucose is lower than you like, then you can do your resistance activity first. And looking at CGM traces and reviewing what's happened helps us to understand the effect on our glucose and plan what's going to happen next time. So the final part is going to be talking about dealing with the risk of hypoglycemia after exercise. So there are a number of different reasons, including increased insulin sensitivity and the need to replenish the energy stores that are being used, which increase the risk of significant hypoglycemia after exercise. And these are particularly there if you exercise late in the day, so that for the purposes of this, that's after 4 p.m. The exercise is prolonged, so lasting over 2 hours, or it's something new, it's something unfamiliar, an exercise you haven't done before. So what CGM can do in this scenario is actually alert you to the fact that your glucose is falling and allow you to treat a falling glucose before it becomes a problem. It can also help to alert you to a falling glucose before you go to bed, because a lot of the risk happens during sleep, and allow you to take a snack to help stave off that falling glucose. And I just want you to remember that the risk of hypoglycemia is increased significantly if you've had alcohol after the exercise. So that's a really important thing to remember. So I hope you've enjoyed this topic of exercise and CGM. By now, we should be able to understand the effects of exercise, different types of exercise on blood glucose, whether CGM can be accurate and useful during exercise, and how you might use CGM before exercise, in real time during exercise, in review after exercise to help us plan for the next time, and to help us prevent hypoglycemia after exercise. And I really hope you enjoy the other topics in this series.